I learned how to drive. I had to, no, don't record this part.
Yes, this is the funniest part.
Okay.
Parents don't know about this yet.
So, I learned how to drive on an old Escort stick shift, okay? And figured it out, whatever. So I've progressed on, not far past that, but I can drive other cars now. And I haven't tried it, but I'm willing to bet that if you put me in a Cadillac, best Cadillac you can find, I could probably drive it. Okay? Why? Because I know what a gas does. Okay, I know what a gas pedal does. I know what a brake pedal does. I could probably find cruise control. The windshield wipers, some of them are on the stick, some of them are on here, some of them are probably push button now. Okay? But I know what the function of each of those is, and I know before I start driving, if I just look around and identify, I can probably figure out how to drive this car. I don't care what kind of car you put me in, I could probably drive it. In fact, if you took me overseas, I could probably drive a car that has a steering wheel on the other side. Might not look real pretty at first, but I could probably do it because I know the functions of each of those, right? As long as you know the function, if you know what frequency, if you know what parameters you need, you should be able to look at an E-Stim, and it might not look real pretty at first. You could stumble your way through it. But if you know that you need a certain frequency, if you know you need on and off times and ramp times, if those are essential to the treatment you're doing, you should be able to look at a machine and either include it or exclude it from what you're trying to do, okay? So even when you go to clinic, you're not going to see these exact, these two especially are most common. You'll see these in clinic. But then you're going to see some crazy looking ones that you've never seen before. But you should be able to stumble your way through it, or at least identify, you know, okay, according to this machine, interferential is this button. You know what interferential is and what it does, you should be able to set it up accordingly, maybe with a little bit of look in the instructions manual, anything like that. Okay? So even if you got an Escort, you can still drive a really, really nice car because you know what it does. Right? That makes sense? You like my analogy there? Okay. So we're to the part of we're figuring out, we've gone through the chart and we talked about alternating current, that there's no use for continuous alternating current. 3 uses for interrupted alternating current, sensory, motor, and pain, and we've gone through those. Okay, so let's start out with the sensory response for pain relief. What can we do with the sensory response? We said that there were 2 options for that.
Differential and high rate.
IFC and high rate 10s. Let's start out with IFC. If you want specific stimulator information, which I'm fine with, on the checkoff you can choose whatever stimulator you want, okay? But I don't want you memorizing one machine, how it works. Because did I tell you this story already? A few years ago, this machine took a crack right before, no kidding, a week before checkoff started. It didn't work anymore. And everybody who practiced their checkoff on this machine, and it didn't work. They had to go to a plan B. So I'd suggest you try it at least 2 different machines. It's going to make you more well-rounded anyway. So, okay. If you have to do interferential current, this one will do it. This is the Intellect Legend combo. There's a difference because this is also an Intellect Legend. So the Intellect Legend combo does IFC, and that's what this is. The Intellect Legend XT, that's my baby, nice, also does IFC. The E-Stim, that's S-Y-S-S-T-I-M, the E-Stim 294, I don't care. I'm not going to ask you on a test. I will not say, what can you do on the E-Stim? This is for your purposes for practicing, okay? So the E-Stim will do interferential current. These are the only stimulators we have that do interferential current, okay? You cannot do it on a TENS unit. So if I get out this TENS unit, and we take a look at it, why can't I do interferential current on this? There's no button that says IFC, okay? What else do we call IFC? MF, medium frequency, beat. Burst was Russian, beat is IFC. MF beat AC. There's nothing on here to indicate that it will do a medium frequency. Okay? A TENS unit is not capable of doing medium frequency. It has nothing about 2,500 hertz. It has nothing about two different, remember for interferential current, we had to have two slightly different frequencies that combine with each other. There's two channels, but they're all the same frequency. They're not interfering with each other. So even if I take a TENS unit and I take the electrodes and crisscross them, I'm not doing the same thing as interferential because I don't have two medium frequencies. So right now, the only interferential stimulators we have are these three, the bigger clinical models. Currently, there are portable interferential stimulators on the market that they're a little bigger than a TENS unit. We don't have one here in class, but in clinic, you might go out and you might see those. We don't have them. Any questions about that? Interferential is 1, 2, or 3 ohm. Our other option then for a sensory level biphasic pulse current was TENS, high rate TENS specifically, because we're just talking about A beta stimulation. We actually have two of these TENS units, one's being used. Any of these TENS units, these are all TENS units. So this small portable one looks like an old beeper. And then the four of these, while they're in a little bit different boxes, are all the same. They look identical. Okay? These ones, I will tell you right now, are easy/hard. These are super duper easy because if you have someone with low back pain, you push the low back button and you turn up the intensity and that's it. This is assuming you know nothing about rate, you know nothing about frequency. Okay? This is just assuming that you want to make it as easy as possible for your patient. TENS units are designed to be portable. They're for people with pain that really haven't responded to other things. Okay, we've tried massage, we've tried hot pack, we've tried some other things, and it hasn't worked really well. TENS is designed to be portable pain relief. You can't lug IFC around with you on the units we have. Okay, you're connected to the wall. These are designed to be portable. You can wear them 24 hours a day for high rate TENS. You can wear them all the time. So they made them super duper easy, simple design. For us, where we just learned that there's specific parameters for high rate TENS, those are harder to set, as we just encountered when we tried to do this just a little bit ago. There are ways to set the rate and the width, but they don't quite fit as neatly into the parameters that are in your notes. So I warn you about that these are easy to set up, but not if you're trying to go exactly by the numbers, okay? If you need to go exactly by the numbers, for example, say on a checkoff, and you want to make sure your parameters are set for high rate, I would use one that looks more like this, because this one you know you can see what exactly the rate is and what the width is. Or I say exactly, but there's big ranges on here. You can see what you're setting and what you're setting it at. Okay? But we do have these newer ones because when you go to clinic, these are probably more what you're going to see. So you need to know both. You need to be comfortable setting up either one.
You're not going to set up a 10 setup ever on one big clinic.
They're not the best, because when we're talking about TENS, we're usually talking about something that's portable. This one and this one both have a biphasic pulse current button on them, where you could do a setup very similar to TENS. You could set it up at 100 hertz and at I think 50 microsecond duration. So you could set these up to be like a TENS unit, but they don't. This doesn't have as many like the modulated mode like this one did that makes it kind of wavy up and down. This one doesn't do that, so it's just always going to be a flat sensation of TENS. It's never going to do the wavy thing that keeps you from accommodating to it. So this is better suited. So potentially yes, but don't write it down as an option because it's just not the best option. It's not even a good option. This is the best. Okay? These are all of our TENS units. Like I said, these ones look just like this one. They're just in a little different box. And the one on the bottom is most similar to this one. It's just a little older even. Turn on at the top, and there's your options. Okay, so we've covered alternating current delivered as an interrupted waveform at a sensory level stimulus. And so we've done high rate 10th and we've done interferential. Okay? Any questions about that?